My name is Nadim Sradj. I am an ophthalmologist in private practice in Regensburg. The subtitle is Junius Kunst disease, and two German ophthalmologists in Bonn who discovered the disease in 1926. My studies of medicine and philosophy were exclusively in Germany. My ophthalmological training was at the University of Gießen for 10 years, under the direction of Professor Kupers, a scientific capacity recognized worldwide. He was called the Pope of Strabismus and Nystagmus and neuro-ophthalmology. 2 of those years, I was a scholarship holder of the German Research Foundation. My interest in philosophy was focused on methodology. And in fact, in research, in ophthalmology research, in macular degeneration research, we have 2 opposite directions. The technocratic apparatus medicine that we all know. It is explained as an explanatory method. The opposite method is the understanding holistic, structural method. Structuralism is more cultivated in France than in Germany as a research method. The research method of understanding and coherent structural theory understands the eye as the guiding organ of the entire body. Not so in conventional medicine, where the eye is seen as a camera, as a photocopying device. Now, the example of reading. When we have a book and we read it, we don't hold the book like this, but like that. We don't keep the book like this, but like that. That is, the center of the body coincides with the center of the object, and we overlay the object and we tilt the head. These organs are examined by palpation, and the diagnosis is made. An old method where the doctor works with his hands. Now the question, how did I come up with the treatment of macular degeneration? When I was working in North Rhine-Westphalia, an elderly lady came to me for treatment with macular degeneration. She had dry macular degeneration, and I referred her to a good clinic, and there she was treated with vasodilators, with infusions, so that the dry macular degeneration has been transformed into a wet one, and visual acuity has deteriorated. That hurt me. That was the reason why I dealt with this macular degeneration. It was a one-sided explanation that macular degeneration is a pure vascular disorder, i.e. artery and veins. And in the beginning, senile macular degeneration, vascular calcification, was called Junius Kunst disease. That wasn't so nice. This has been modified from senile macular degeneration to age-related macular degeneration. But they insisted on fixation-only vessels. Veins and arteries are disturbed. All others are fine. That's not right. There is no lymph metabolism, no cognition of the eye muscles, no diagnosis of the nervous system, because the eye is an advanced buttocks. This negative experience with vasodilation infusion therapy has caused me to question the system. In Germany, there was no way to get new knowledge due to the bureaucracy, so I had to go abroad. My first stop was France. In 1992, the French Academy of Ophthalmology wrote a book, Bio-Ophthalmology, Introduction of Modern Physics, Introduction of Thermodynamics in Ophthalmology, Entropy and Chaos Theory and Catastrophe Theory. This means that it is about the self-organization of the organs. In concrete terms, this means that you want to sleep and cannot sleep. The consequence is that we cannot dispose of our organs. The second trip was to Russia, where Filatov introduced tissue therapy into ophthalmology. and Professor Muldashev introduced macular degeneration therapy and microsurgery from Professor Muldashev in Ufa, in Switzerland, with Professor Bangerter in St. Gallen. I have learned to put conservative injections not in the eye, but next to the eye. And so I also have to add radiotherapy as a complementary therapy to systemic therapy. The radiotherapy, the radiation. Well, all of these insights led me to formulate my systems therapy. We always want logic and clarity of thought. Retinal degeneration, i.e., retinal macular degeneration. A degradation of the eye and regeneration buildup. So degeneration is answered with regeneration. Agents such as cortisone and Tromil are introduced or applied against inflammation. But regeneration takes place by administering organ-specific preparations, peptides and proteins, but also stem cells. Not to forget vitamin B, that is, agents that allow the regeneration of the disease and thereby improve visual acuity without side effects. And this has led to these findings being expanded that neural therapy is used, but also the acupuncture of the whole body and especially the head. I presented my systemic therapy in ophthalmology in New York, at the clinic in Buenos Aires. But above all, at the United Nations in Manhattan. I am a member of an international medical organization, non-governmental organization, member of the United Nations. There, also in the United Nations. The eye exercises and color exercises are important. What we should pay attention to, what needs to be treated. The perception time is extended. You have to emphasize this in the consultation, when driving, in traffic, that you recognize the speed of other objects, cars and other vehicles. How you have to behave on the street. And I now have to present these successes in a statistic. I show you the results and the statistical evaluation of 3,684 patients. The younger the patient, the more successful the treatment becomes. The older the person is, the more the results of the successes are reduced. This means that if the disease appears at a later age, it is the irreversible phase of the disease. There is really not much you can do about it. I wrote a book about macular degeneration. The first half for the patients, the second half for the doctors. A book on eye exercises. Also a book on color exercises. What is interesting about macular decay are hearing disorders, headaches, memory disorders, and taste disorders, and the mouth. Here, the nerves are part of macular degeneration, are represented that the ear is affected. Headaches and migraines in particular play a major role in the detection and treatment of macular degeneration. The other sensory organs may also be affected, but it is different. But the nerve components of macular degeneration must be taken seriously and also treated. The summary of the therapy consists of these elements: injections in addition to the eye, not into the eye; neural therapy, cranial and ear acupuncture, eye exercises, and color exercises. From my many years of experience and the statistical evaluation of 3,684 patients, it has become clear that the earlier the treatment begins, the more successful the treatment will be. Thank you for your attention.